Come to grips with deadly gun violence. Other major cities like Atlanta, Washington, D.C. also seeing a spike in children being killed or wounded.
Now the National Medical Association is calling on officials to declare gun violence a public health emergency. So joining us now to talk about that is Dr. Roger Mitchell, Jr. He is chair of the Violence Task Force of the National Medical Association. Doctor, thank you so much for joining us.
It's my pleasure. Thank you.
By calling it a public health issue, what would that mean?
Well, you bring all the resources to bear. One of the things we know about a public health emergency, because we are living a pandemic right now, it brings the infrastructure, it brings the necessary intelligence, it brings the necessary expertise, and it brings people together to talk about a solution to prevent the deaths that we're seeing in our community. So a public health emergency will bring all the tools together from across all disciplines to deal with this issue.
This is something that would be dealt with on the federal level, something that Congress would have to approve, I take it?
Well, Congress would have to approve if there was appropriations that the local jurisdictions would be looking for. But local jurisdictions have the means and capabilities of establishing public health emergencies. We've seen that in COVID. So that public health emergency can happen at a state level, a county level, and a city level. And it's important for us to approach this in a very different way when so many people are dying from gun violence.
Has this been tried before, and why has the National Medical Association come up with this? What made you come up with this?
Well, it hasn't. And quite frankly, a lot of places still believe that violence or gun violence is just strictly a law enforcement or criminal justice issue. But as we become more informed about this process, we realize that it is truly a public health issue that has social determinants of health at its core. Where we live, work, where we play, access to education, economics, housing, healthcare, and criminal justice, all leads to outcomes, positive or negative, as it relates to gun violence. So no, this hasn't been tried before, but I think we have to be innovative in this day and age and when we're trying to save lives.
How do you get the attention or the favor of people who are skeptical about this kind of a thing?
Well, I think you've done a good job. I mean, we're on this network, which is the largest network in the Chicago area, talking about this issue in a city that has history and current suffering from gun violence. Washington, D.C., where I reside, also has this issue of gun violence. But gun violence is not a homicidal issue, although that is extremely important. The majority of gun violence that we see is suicides in communities throughout this country. And so it's important that gun violence is something that we see that affects all communities, not just the communities over there.
How confident are you that this just might work?
Well, I think the more audience we get surrounding this, I think people at their core want gun violence to end, whether it's a suicide that has happened in their family or whether it's a homicide of an 11-year-old boy. Nobody wants to see people die needlessly. And I think that people are willing to let medicine and the public health infrastructure take the wheel. Quite frankly, law enforcement by themselves are not the answer. And if you ask law enforcement, they'll tell you they want social workers at the table. They want the emergency departments at the table. They want universities at the table and other public health providers at the table to develop a solution.
Dr. Mitchell, we applaud you and the National Medical Association for trying to at least add to a possible solution to this. Thank you so much. Be safe, be well.
Bless you.
Still ahead, fans of the late Chicago rapper